You're in your kitchen, or maybe you're just walking down a hallway in your home, and for a few seconds, the world feels slightly off. It's subtle, maybe one eye blurred, as if you were looking through a smear on a window. Maybe your hand felt odd, or your speech tripped over a simple sentence. It lasted 10 seconds, maybe 30, and then, just like that, it was gone. You feel fine now. Most people in that situation do one thing. They convince themselves it was nothing. They think they were just tired or stressed, or maybe they just stood up too quickly. They walk away, relieved, and they move on with their day. But I want you to pause for a second. What if I told you that moment wasn't a random glitch? What if that brief, strange, vanishing sensation was actually a message? My name is Dr. William. I've spent years working with patients on the front lines of health and longevity, and I've learned one inescapable truth. Our bodies are constant, loud communicators. We often think of sudden, major health crises as lightning bolts, strikes from a clear blue sky. We see someone go from healthy to hospitalized, and we assume it happened in a heartbeat. But the reality is almost always a slow-motion process that's been building in the background for years. If you learn to read these signals, you aren't just a passive passenger in your own body, you become a partner in your own survival. We're going to look at what these early warnings actually look like, why they're so easy to miss, and most importantly, how to have a real, productive conversation with your doctor so that these moments don't become a permanent part of your history. We're going to strip away the fear and replace it with a clear, calm protocol for your own protection. To understand why these warnings happen, we have to look at what's actually happening inside your blood vessels. Think of your arteries not as rigid, stationary pipes, but as highly elastic, high-pressure rubber bands. When you are younger, these vessels are incredibly flexible. They expand when your heart beats and contract when it rests. This elasticity is what keeps your circulation smooth and steady, delivering a constant, reliable supply of oxygen to your brain and heart. As we age, or as our internal environment changes due to factors like blood pressure, blood sugar, and systemic inflammation, those rubber bands start to lose their snap. They get stiff. Over time, they develop tiny, microscopic roughened patches on the inside wall. These aren't just clogs. They are areas where the smooth, natural inner lining of the vessel, the endothelium, has become irritated or inflamed. When that inner lining is damaged, it's no longer the super smooth surface it should be. It becomes sticky. Imagine running water through a clean, smooth plastic tube versus a tube that's been scratched and scuffed on the inside. In the scuffed tube, particles start to catch. Sometimes a tiny fragment from one of these roughened patches breaks away. It travels up through your bloodstream, and for a fleeting moment, it wedges into a narrow branch, cutting off the supply to a very small area of tissue. This is what I call the glitch. It's not a full-scale event yet. It's a temporary restriction. Because the fragment is small, or the vessel diameter is just wide enough, your body manages to clear the obstruction. Flow returns. The symptom vanishes. You feel normal again. But the reality is that your body just gave you a feedback report. It's telling you that the internal environment of your vessels is no longer smooth enough to guarantee safe passage for blood. The danger isn't the glitch itself. The danger is the assumption that because the symptom is gone, the problem is solved. Most of us are taught to treat the symptom as the problem. But in this case, the symptom is just the alarm. The problem is the health of the wiring behind the wall. What does this feedback actually feel like? Because these moments are fleeting, people often struggle to describe them to their doctors. They end up sounding vague, which leads to the dreaded, "It's probably just stress," or "That's just aging." To prevent that, we need to be specific. There are 4 distinct patterns that commonly appear as early feedback. The first is the visual hiccup. It's not usually a complete loss of vision. It's more like a temporary shadow, a shimmering effect, or a brief partial fog over one eye. It might feel as if you've suddenly developed a blind spot that moves. You blink, You wait a few seconds, and it clears up. Most people blame the lights, or their glasses, or maybe a headache. But if this happens, especially if it's only in one eye, it's a major clue. The artery that feeds your eye is a direct branch of the main vessel supplying that side of your brain. If something is blocking the path to the eye, it's telling you there's an obstruction in the main highway. The second is sensory drift. This is that pins and needles sensation, but it's localized. It's not your whole foot falling asleep because you sat on it. It's a sudden, weird, tingling numbness that affects one specific area, maybe just one hand, or one side of your face, or the entire left or right arm. The key here is that it's asymmetrical. It happens on one side of the body because the brain is organized in hemispheres. If you feel this on both hands at the same time, it's much more likely to be something like a neck issue or nerve compression. But a sudden one-sided sensory shift? That's a signal coming from the brain's map, not your skin. The third is the coordination wobble. You know that feeling of being a bit unsteady? Imagine you're walking down a hallway you've walked 1,000 times, and suddenly, for no reason, you veer to the left. Your foot doesn't land where you told it to. You might reach for a door frame or feel a sudden, intense burst of dizziness that forces you to sit down. We aren't talking about vertigo when you stand up too fast. This is a sudden, unprompted loss of balance on level ground. The area of the brain responsible for coordination is tucked away at the back of the skull, and it's very sensitive to changes in blood flow. When it glitches, your internal GPS briefly disconnects from your legs. The fourth is verbal stumbling. We all have tip-of-the-tongue moments. That's normal. What isn't normal is a sudden breakdown in your ability to form words or understand them. You might know exactly what you want to say, but the connection between your brain and your tongue feels severed. The words come out slurred, or you say something that makes no sense, and you are aware of it. If this happens, even if you can correct it after a minute, it's the brain's way of saying the speech centers are temporarily struggling for oxygen. Have you ever experienced a moment like this, where you felt something off, but just decided to ignore it? Tell me about it in the comments below. Sharing those experiences helps others realize they aren't the only ones who have felt these subtle shifts. Here is the challenge. You go to the doctor and you say, "I felt a bit dizzy yesterday." The doctor hears dizzy, which could mean a dozen things, from dehydration to an inner ear issue to high blood pressure. They see a busy clinic, and they follow the path of least resistance. You need to change the script. You need to be a partner in your own evaluation. When you feel these moments, don't just wait and hope they don't return. Start what I call a vascular feedback log. Keep a small notebook by your bed or on your desk. When you have a glitch, write down the exact time and duration, the specific sensation, and the context, like what you were doing at that moment. When you see your doctor, you don't say, "I felt weird." You say, "Dr. Smith, I've experienced 3 episodes of symptom over the last month. Here is my log of exactly when and how they occurred. I'm concerned about the vascular health of these arteries, and I'd like to understand if this is a transient feedback issue." That is not being a difficult patient. That is being a precise, prepared patient. It changes the entire conversation. It moves you from patient with vague complaint to partner with data. A doctor who sees this log has something concrete to evaluate. They can order the right tests, like an ultrasound of the neck arteries, or a heart rhythm monitor, because you've provided the data they need to justify those investigations. A quick note of caution here. If you ever experience these symptoms, do not attempt to self-medicate or start taking aspirin or other blood-thinning agents on your own. There are 2 major types of vascular events, and what helps in one can be dangerous in the other. Leave the diagnostic and treatment decisions to your medical team. Your role is to provide the best, most accurate data possible. Once you understand that your blood vessels are a system that requires maintenance, you start looking at your daily habits differently. We talk a lot about lowering numbers, lowering blood pressure, lowering sugar, lowering cholesterol. But I want you to start thinking about protecting the lining. Think of your endothelium, that inner lining of your blood vessels, as the most important organ you've never heard of. It's the gatekeeper. When your blood sugar stays consistently high, you aren't just having a high number. You are bathing that delicate, smooth inner lining in a substance that can be abrasive. It's like running sandpaper through your plumbing. When you smoke, you are introducing direct chemical irritants that cause your vessels to spasm and inflame. When you live with chronically high blood pressure, you are physically stretching the walls, causing them to thicken and scar. Longevity isn't about being perfect. It's about reducing the sandpaper effect. Focus on consistent, moderate movement. Walking is one of the best ways to maintain vessel flexibility because it encourages a steady, healthy rhythm of blood flow that keeps the endothelium exercised. Focus on stable energy. Instead of massive spikes in blood sugar from processed snacks, focus on steady fuel that keeps your vessels from having to deal with inflammatory surges. And finally, prioritize the rhythm check. If you ever feel like your heart is skipping a beat or fluttering, that's not something to ignore. Sometimes the glitch isn't in your head, it's in the pump itself. Atrial fibrillation, that quivering heart rhythm, is a common contributor to these vascular feedback events. If you feel a weird rhythm, bring that up. It's a very manageable issue once it's detected. Do you have a regular habit that you find helps you stay steady and calm? Sometimes sharing those small habits can inspire others to try them too. We've talked about the glitch, the fleeting moment. But what if the moment doesn't go away? There is a simple, universally recognized safety net for this. We use the acronym FAST. F is for face. Does one side of the face droop? Ask yourself to smile in a mirror. Does it look even? A is for arms. Can you raise both arms? Does one drift downward uncontrollably? S is for speech. Can you repeat a simple sentence without slurring or getting the words wrong? T is for time. Time to call emergency services. If any of these things are happening and they don't fade away within those first few minutes, you don't wait for a log, you don't call a friend, and you don't drive yourself to the clinic. You call for emergency help immediately. This is the emergency protocol, and it's the one thing that should never be delayed. There is a final piece of this puzzle that rarely gets discussed: the mental load. Once you know that your body sends signals, it is very easy to turn every single minor sensation into a catastrophe. Every time you forget a name, you worry it's a stroke. Every time you have a muscle twitch, you worry it's the start of a vascular issue. This is the hypervigilance trap. The goal of health guardianship is not to turn your life into a non-stop diagnostic exam. It is to move from a state of unconscious ignoring to a state of conscious awareness. You don't need to fear your body. You need to respect it. When you have a routine, when you eat foods that don't spike your sugar, when you move your body daily, when you keep your blood pressure managed, you are doing the work. You are tending the garden. You can trust the process you are building. If you feel a sensation, check your log, check your context. If it's a singular, isolated event, breathe. If it becomes a pattern, a recurring, specific feedback signal, that is when you use your log to get the professional evaluation you need. But you don't need to live in fear of the next hour. You just need to live with the awareness of the long term. Most people think that a close call is a sign that they've run out of luck. I see it differently. I see that moment, that tiny fleeting shadow in your eye, that brief wobble in your step, as a gift. It is your body's way of saying, I am reaching my limit, but I am still working. It is a second chance. When you act on that second chance, when you start the log, when you have the conversation with your doctor, when you adjust the daily habits, you change the trajectory. You aren't just preventing a stroke. You are actively building a stronger, more resilient system for the next 20, 30, or 40 years. Does this shift in perspective help you feel a bit more in control of your health? I hope it does. If you've ever had a moment where you felt like your body was sending you a message, tell me about how you handled it in the comments. Senior health isn't about being afraid of what might go wrong. It's about having the knowledge to keep things going right. And remember, knowledge is only the first step. Action is the bridge to the results you want. If you felt lost trying to navigate all the health advice out there, don't go it alone. That's why we do this. I'm Dr. William, and this is Senior Health Sessions. If you found this perspective useful, hit the like button. It helps other people who might be ignoring their own early warning signs find this video. Stay proactive, stay informed, and I'll see you in our next session. As we look at the broader picture of your long-term health, I want to briefly touch on the maintenance mindset. We often view health as a series of crises to be averted. We wait for a number to go up, a pain to start, or a symptom to appear, and then we react. But what if we flip that? What if we treated our vascular system with the same preventative care we give to our cars or our homes? We change the oil in our cars before the engine seizes. We check the roof for leaks before the water enters the walls. Why do we wait for our arteries to send us a glitch before we decide to look at them? You have the power to create a vessel maintenance plan. It starts with the 3 pillars of vascular resilience. Pillar 1, the blood sugar balance. You don't need to be diabetic to worry about blood sugar. Even the high normal range can be damaging over the span of decades. Think of your glucose as a measure of potential friction in your vessels. The more stable your fuel, the less friction you create. A simple, consistent way to do this is to prioritize fiber and lean protein early in your meals, rather than starting with quick carbohydrates. It's a small, daily act of protection for that sensitive inner lining. Pillar 2, the pressure regulation. We obsess over the blood pressure number, but we often forget about the pressure variation. Your arteries hate rapid swings. They like consistency. Stress is a massive, overlooked driver of vascular pressure swings. A quick 5-minute breathing session in the morning or before bed isn't just relaxation. It is a physiological intervention that helps stabilize your vascular tone. It keeps the rubber band from being stretched and released too violently. Pillar 3, the movement consistency. I want you to forget the idea of getting a workout. That's not what we're aiming for. We're aiming for vascular frequency. The more often you move, even just walking at a gentle, steady pace, the more often your vessels are encouraged to expand and contract in a healthy rhythm. You are literally pumping blood into the smaller peripheral vessels that usually get neglected when we sit for hours. You are keeping the entire system flushed and clean. These aren't radical overnight transformations. They are boring, everyday, invisible acts of guardianship. And boring, everyday acts are exactly what prevent life-altering events. One of the biggest questions I get in the clinic is this: Dr. William, at what point does just getting older become a vessel issue? It's a fair question, and it's the gray zone of senior health. As we get older, our processing speed slows down. We might not retrieve a word as fast as we did at 20. We might have a stiff joint that makes us walk a little differently on a cold morning. How do you distinguish this from a TIA, a warning stroke? The answer lies in the principle of suddenness. Age-related changes are usually gradual. You didn't wake up yesterday unable to find your keys if you could find them perfectly fine for the last 50 years. That's usually a slow, progressive decline in memory retrieval. Vascular events, by contrast, are almost always marked by suddenness. If you are walking perfectly fine, and then suddenly, without a change in the floor or your shoes, you stagger, that is a sudden event. If you are speaking clearly, and then suddenly, within a few seconds, you cannot get the words out, that is a sudden event. If you are seeing clearly, and then suddenly a curtain falls, that is a sudden event. The suddenness is the diagnostic marker. It is the signature of a vascular obstruction. If you have any doubt, if a symptom seems to arrive from nowhere and then depart just as quickly, don't play the "is it just old age" guessing game. That is exactly where the risk lives. Log it. Talk to your doctor. Get the baseline. Even if it turns out to be nothing, you have established a record, and that record is the most powerful tool you have. You are the guardian of your own health. Nobody else lives in your body. Nobody else feels those subtle shifts. Nobody else knows your baseline like you do. When you start to pay attention, really pay attention, you realize that your body isn't an enemy that's out to get you. It's a complex, aging machine that is constantly trying to report its status to you. Listen to the report. Don't fear the report. Use the report to make better decisions. You have more influence over your vascular destiny than you likely realize. It isn't written in stone. It's written in the daily, small, often invisible choices you make. The food you choose, the way you manage your breath, the way you stand up for your health in the doctor's office. You have the capacity to be the strongest advocate for your own longevity. Thank you for trusting me with this time today. We've covered a lot of ground, from the mechanics of the endothelium to the specific ways to talk to your healthcare team. If you found this approach to health guardianship helpful, take a moment to pass this on to someone in your life who might need that same level of calm, actionable clarity. I'm Dr. William, and this is Senior Health Sessions. We're here to help you understand your body so you can keep living on your own terms. Take care of yourself, stay observant, and I'll see you next time.